He's got a knife in his hand and he's waving it around, stopping all the nurses, doctors and healthcares and everybody else who works in the emergency department from actually getting into the building. He's screaming and he's shouting, and this is my first day at work. This was obviously a few years ago. It's not something recent that has happened, but it was a frightening experience. And let me tell you exactly how it was dealt with. I was very junior at that point. I didn't know exactly what to do. There's me looking around thinking, there's a guy with a knife. He's waving it around and he's acting very odd. Immediately I'm thinking there's probably some form of psychosis, basically a mental health condition, and it may not be this person's fault. Luckily, the person who came right behind me and started saying, "Stand back," was actually one of the senior emergency medicine consultants at that time, who also happened to be the medical director of the hospital. He was absolutely amazing and brilliant. Me as a junior person didn't know what to do apart from make sure nobody else comes near this person, and obviously not go near them myself, because you don't know what somebody might do with a knife. But this consultant absolutely took charge, kept people away, and he gave advice. He told me to block off one of the sides so that patients couldn't come down that way, but also to prevent this person from moving anywhere else. He actually had a briefcase on him. He put it down and he started talking very calmly to this person wielding this knife. Luckily, as he was talking to this person, he actually dropped the knife because he stumbled over some rocks. The knife dropped onto the floor and I was told to go and pick it up, and what I actually did was I kicked it out of the way before going to pick it up. Luckily, because this person had a mental health condition, they were not in their right frame of mind to really understand what was going on, and that's what made it easier to take control and charge of the situation. And luckily, because there was nobody else involved, it meant we could actually deal with the situation much more safely because there's no one else being compromised. The person was then taken to the emergency department with security and then actually sedated because they became highly agitated. So we thought there might be drugs on board. Then eventually, after doing different tests and scans, there was nothing medical that was causing this patient's problem, and it turned out that they had an acute psychosis. This is a severe mental health condition where the brain function just doesn't work. The person doesn't have the ability to really understand anything, so they don't have something called mental health capacity. And as a result of that, it means they're not in control of their thoughts and processes and outcomes. And so we had to care for this patient, and we did. And we got them seen by the mental health team, the psychiatrists. And eventually, over a long period of time, this person got better. This is one of those amazing stories of where something is going in very negative, dangerous situation, but we get a fantastic, great outcome. And that's because of rapid problem solving, quick thinking, keeping people safe, and keeping that person safe as well. Because imagine if they had done something and hurt somebody else. That wouldn't be fair to the victim, but it wouldn't be fair to them because they are someone who does not have the ability to know what is going on. A doctor's duty should always be to protect everybody else, protect the patient, and always think outside of the box. My name is Dr. Singh, your emergency medicine specialist. Thanks for watching.